This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Talking about the diabetic condition. The topic on today's discussion of Your Health, a special program brought to you by the Health Broadcasting Service HBS radio channel, is diabetes. Let's talk about diabetes. Diabetes has become a common condition worldwide. Majority of people have no clear-cut knowledge of what constitutes this condition. So therefore, what is diabetes? Diabetes is a lifelong condition that causes a person's blood sugar level to become too high. There are two main types of diabetes. Type 1 diabetes, where the body's immune system attacks and destroys the cells that produce insulin. Type 2 diabetes, where the body does not produce enough insulin, or the body's cells do not react to insulin. Type 2 diabetes is far more common than type 1. In the UK, around 90% of all adults with diabetes have type 2. During pregnancy, some women have such elevated levels of blood glucose that their body is unable to produce enough insulin to absorb it all. This is known as gestational diabetes. There are no known lifestyle changes that can make to lower your risk of type 1 diabetes. However, you can help manage type 2 diabetes through healthy eating, regular exercise, and achieving a healthy body weight. The pre-diabetic stage. Many people fall under this category, and indeed many more people have blood sugar levels above the normal range, but not high enough to be diagnosed as diabetic. This is known as the pre-diabetic stage. If your blood sugar level is above the normal range, you are at a significant risk of developing full-blown diabetes. It is particularly important for diabetes to be diagnosed as early as possible, because it will get progressively worse if left untreated, and the risk of complications increase with time. So see your doctor as soon as you suspect diabetes. When you should see your doctor. Visit your health professional as soon as possible if you experience the main symptoms of diabetes, which include feeling very thirsty, urinating more frequently than usual, particularly at night, feeling very tired, weight loss and loss of muscle bulk, itching around the penis or vagina, or frequent episodes of thrush, cuts or wounds that heal slowly, blurred vision. Type 1 diabetes can develop quickly over weeks, or even days. Many people have type 2 diabetes for years without realizing, because the early symptoms tend to be general. What are the known causes of diabetes? The amount of sugar in the blood is controlled by a hormone called insulin, which is produced by the pancreas, a gland behind the stomach. When food is digested and enters your bloodstream, insulin moves glucose out of the blood and into cells, where it's broken down to produce energy. However, if you have diabetes, your body is unable to break down glucose into energy. This is because there's either not enough insulin to move the glucose, or the insulin produced doesn't work properly. Although there are no lifestyle changes you can make to lower your risk of type 1 diabetes, type 2 diabetes is often linked to being overweight. Go out of your way to learn how to reduce your diabetes risk. Talk to your health professional today. Living with diabetes. If you are diagnosed with diabetes, you will need to eat healthily, take regular exercise, and carry out regular blood tests to ensure your blood glucose levels stay balanced and within a healthy range. You can use the BMI healthy weight calculator to check whether you are a healthy weight. People diagnosed with type 1 diabetes also require regular insulin injections for the rest of their life. As type 2 diabetes is a progressive condition, medication may eventually be required, usually in the form of tablets. Ask your doctor questions about treating your type 1 diabetes once you are diagnosed. Similarly, ask questions about your type 2 diabetes if you have been diagnosed. Stick to the doctor's recommendations and advice. Learn to live healthily with your diabetes. Keep an eye on your weight. Say no to being overweight, otherwise known as obesity. Diabetic eye screening. Everyone with diabetes, aged 12 or over, should have their eyes screened once a year. If you have diabetes, your eyes are at risk from diabetic retinopathy, a condition that can lead to sight loss if not treated. Screening, which involves a half-hour check to examine the back of the eyes, is a way of detecting the condition early so it can be treated more effectively. Untangling the complications of diabetes. In Lancet's issue of June 16, 2018, Volume 391, The Global Burden of Disease 2016 study reported diabetes to be the 12th leading cause of disability globally and attributed nearly 1.5 million deaths to diabetes worldwide. Other studies estimate that the number of people living with diabetes today ranges from 415 million to 420 million, with a projection of as many as 700 million people living with the disease by 2025. Aging populations, increasing urbanization, and widening social inequalities are all contributing factors to the rapid rise in diabetes prevalence seen over the past 40 years. In the era of the United Nations Sustainable Development Goals, reducing premature mortality from non-communicable diseases, including diabetes, has become a global priority. For people with either type 1 or type 2 diabetes, advances in clinical care, such as development of better glucose-lowering drugs and structured education programs, have led to considerable increases in life expectancy. Effectively, more people are living with diabetes for longer. Understanding the disease course, onset of complications, and comorbid conditions is critical to improving specialized care for people with diabetes. In this issue of The Lancet, Ed Gregg and colleagues report on trends in cause-specific mortality among adults with and without diagnosed diabetes in the USA. Using national vital statistics data, the authors show a staggering tripling of diagnosed cases of diabetes in the USA from 6.2 million cases in the late 1980s to 21.1 million cases in the early 2010s. Deaths attributable to cardiovascular disease for both men and women with and without diabetes declined significantly over the periods analyzed. Although still numerically higher, the rate of cardiovascular-associated deaths in people with diabetes declined far more rapidly than for those without diabetes. Modest by comparison, but encouraging nonetheless, overall cancer-related mortality was also reduced due to declines in deaths from breast and colorectal cancers, but deaths from pancreatic and liver cancers have increased. In people with diabetes, deaths from other causes, such as unintentional injuries, lower respiratory tract disease, hypertension, infections, and renal disease, were all increased. These data clearly demonstrate the complexity of the story underlying mortality in people with diabetes. And the picture presented in the USA will most likely be reflected in other regions as the global epidemic marches on. The diversity in causes of death signals an important call for clinical management and public health reform to better care for patients with diabetes. Undoubtedly, reducing risk of cardiovascular disease is important, but increases in liver and renal disease and in deaths from sepsis and other infections cannot be ignored. More research focused on the mechanisms driving the increase in unintentional injuries is urgently needed. Understanding the genetic underpinning of diabetes pathogenesis and risk of developing complications has the potential to help shape clinical management at an individual patient level. New technologies and data from large-scale genome projects, such as the UK Biobank and the Haplotype Reference Consortium, have equipped researchers with powerful tools to better understand diabetes. In today's Lancet, Claudia Langenberg and Luca Lotta review the contributions of genomic studies to developing new therapeutics and understanding molecular pathways implicated in disease pathogenesis, as well as diagnosis of common subtypes of diabetes. One such study is that from Emma Alkvist and colleagues published in The Lancet Diabetes, and endocrinology, which used a priori clustering to identify novel subtypes of diabetes based on 6 readily measured clinical parameters: body mass index, age at diagnosis, HbA1c, glutamate decarboxylase antibodies, beta cell function, and insulin sensitivity. The 5 resultant subgroups were each found to be associated with differing disease progression and risk of specific complications. Genetic loci associated with diabetes or related traits were then analyzed and mapped to each subgroup. Further characterization of the genetic architecture of these groups could reveal new markers for identifying patients most at risk for complications, such as ketoacidosis and non-alcoholic fatty liver disease. People with diabetes are leading longer lives. As mortality from cardiovascular complications continues to decline, attention must be turned to identifying, preventing, and treating other diabetes complications. There is no scope for complacency in diabetes care. Understanding and managing complications associated with the disease must become a clinical and public health priority. If you are unsure about your condition of health after listening to this segment, or you suspect you might be suffering from the condition, please call your health professional and get checked immediately. You should soon be on your way to good health if you do. Or if you have already received a diagnosis, stay abreast of treatment developments by keeping your doctor's appointments religiously and obeying the rules. Maintain a balanced weight and stay healthy. Our sources for this segment have been the NHS England and the Lancet England. If you are diabetic and you have questions, please feel free to email us at contact@healthbroadcastingservice.com. We will round up this important topic on this note. We will bring you more information from time to time. This program has been brought to you by the Health Broadcasting Service, HBS Radio Channel, UK. Remember to stay abreast of our broadcasts by subscribing to our channel to receive future helpful and beneficial episodes. We will be back again soon. And until then, it's bye for now.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel